Good evening, everyone. It's a Friday evening and it is time to start our live event tonight. So thank you already for joining us, and thank you, Elisa, for joining us as well. And I just want to mention that Elisa Moya Gutiérrez, she's the embryologist from Vistahermosa clinic, which is located in Alicante. And I'm very happy to have you back because this is your second webinar with us.
Yeah.
So thank you for joining. And how are you feeling tonight? Hope all is well.
Well, thank you, Caroline. I'm feeling good. And I want to thank everybody for being here on a Friday evening. And
Yes,
well, I hope
indeed.
you enjoy it. Yes.
Thank you so much. And of course, as you can see, we have another topic because we started yesterday. The main topic is male fertility, and tonight we will talk about protecting sperm before it's too late. So I'm very happy that we have another topic on that. As we know, those kind of topics are still not that common, I would say. Even we always focus on women, and as we know, this is something that we also should be discussing. So I'm very, very happy that you will talk about it tonight. And as always, we will start with the presentation, and afterwards this will be your part. You can ask your questions simply by putting them in the chat section, and Elisa will answer them for you after the presentation. So don't hesitate. Anything that's on your mind, you can simply ask it. And of course, as you know, my IVFenses, we are part of European Fertility Society, as we simply want to give you opportunity to ask your questions, but also to educate you, to give you the chance to meet top fertility experts. But as you know, we also have some psychologists, coaches, yoga teachers even here, anyone that can actually help you out with your questions, but also some can give you some more details on various topics as well. And that will be it from me, okay, at this point.
Okay.
And I believe we can start with the presentation. So let's go ahead then.
Okay, thank you, Caroline. As you said, today we're going to talk about protecting the sperm before it's too late. So first of all, infertility is defined as the inability to achieve gestation after 1 year of unprotected sexual relations. And this affects 15% of the couples of reproductive age. And the male factor is responsible for up to 40 to 50% of the cases of sterility in the couple. So, concerns about seminal quality have been increased in recent years due to the decline in the seminal parameters set by the World Health Organization. So although all this fall in values does not imply sterility, it results in a difficulty to get in pregnancy. And there are multiple cases that can affect seminal quality, as multiple factors that may interfere with the proper formation of the sperm, which is called spermatogenesis, its transport by the male genital system from the testicle to outside with the ejaculate, and its deposition in the female genital tract, or even in the fertilization process. So there are many factors that can interfere in all these processes. The most common causes associated with male sterility are varicocele, which is the swelling of the veins inside of the scrotum, infection in the seminal root, immunological pathology, developmental anomalies, endocrinical pathology, mechanical causes such as disturbance in the erection or the ejaculation, genetic causes, and then toxic drugs, labor factors, and all paternal age. So today we're going to focus on the last two ones, which are the environmental factors and the things that we can avoid to or improve for a better seminal quality. So for evaluating the quality of the sperm, in reproductive clinics, we offer different kinds of tests. And the basic one is called seminogram, and this is the study of the seminal quality, in which we measure the volume, the concentration of the sperm in the ejaculation, which should be more than 15 million per milliliter, the sperm motility, which should be more than 32% of motility. The vitality should be more than 58% of live sperm. And morphology, there must be at least 4% of sperm with normal morphology. But sometimes we need additional evidence for further analysis. And among them, we have diagnostic capacitation that measures progressive moving sperm count, sperm DNA fragmentation test that measures breaks or lesions in the sperm genetic material. So the greater the number of injuries, the lower the integrity of the genetic material and the likelihood of pregnancy occurring at the end. And then we have sperm fish test that detects genetic abnormalities. So as I said before, today we will focus in particular in environmental factors, such as toxin factors, life habits, and everything that we can be in our power to improve or not worsen the quality of the sperm. And scientifically proven to have an influence on seminal quality are obesity, smoking, drugs, and chemicals. So let's start talking about obesity. It's understood obesity as a body mass index more than 30 kilos per square meter. And as we all know, it's associated with various healthy problems, such as cardiovascular, diabetes, hypercholesterolemia, but it also affects fertility. And this is because obesity is associated with hormonal changes that can lead to a reduction in seminal quality. And how does affect obesity the fertility? Well, testosterone is one of the hormones involved in spermatogenesis, and it has been found that when a high amount of fat is present, testosterone levels decrease and estradiol levels increase, and this inhibits sperm production. The volume of the Gs may also be affected. And also, in addition, a low level of testosterone may lead to problems of erectile dysfunction and consequent difficulty in achieving pregnancy in a natural way. The creation of ICSI, or in other words, intracytoplasmatic sperm injection, is a technique that allowed couples in which men have low seminal quality or ejaculatory problems to become pregnant. But recent studies have analyzed that the results of this type of treatment by comparing the results of treatments where the male has a normal body mass index versus the man who has a high body mass index, it has been found that overweight may adversely affect the outcome of the treatment. So obesity will affect both if you want to try to achieving a pregnancy in a natural way, or even it can affect the therapy with in vitro. The link between smoking and the seminal quality has been widely demonstrated. Tobacco consumption has been mainly associated with a decrease in spermatozoa count and the damage of DNA of spermatozoa. I will focus on the damage of the DNA spermatozoa, but first I want to mention that cigarettes are mostly composed of nicotine, alkaloids, amines, ketones, and many more toxic substances. And all these compounds have been detected in the seminal plasma because they cross the hematotesticular barrier. And this influences directly to the quality of the sperm. So as I said, I want to focus on the damage on the DNA because recent studies suggest that tobacco increases the fragmentation of the DNA, and this increase, the spermatic DNA ruptures may have a negative impact in the natural fertilization process, and it also can affect the results in assisted reproductive techniques. And it's associated with a decrease in fertilization and implantation rates and an increase in embryo blocking and miscarriage rates. About the drugs, well, there are multiple drugs that can affect fertility. The most harmful drugs for reproduction includes cancer treatments. Chemotherapy and radiotherapy are very aggressive treatments for spermatogenesis, and depending on the type of the drug and the radiation dose, this effect may be definite or transient. So it's essential to freeze the sperm preventively at the time of diagnosis of a systemic or oncological disease, which by itself or by treatment endangers future fertility. But there are other drugs that might affect fertility, such as immunosuppressors, neurodrugs, such as antidepressants or antiepileptic or neuroleptic drugs, and of course hormones. And I want to focus on anabolic androgenic steroids because these are synthetic derivatives of testosterone, and it's been used by many sportsmen to enhance athletic performance and appearance without prescription. So the adverse effects includes problems in the liver, serum lipids, psychological or behavior problems, and also reproductive system problems, because it has a negative impact on the spermatogenesis, and sometimes this effect is irreversible. About the recreational drugs, I want to talk about marijuana because it's the most widely used recreational drug in the Western world. And cannabis is a drug that depresses the nervous system. It contains the compound of molecule of THC, which is a psychoactive compound. And it can cause adverse effects in the endocrine and reproductive system, especially decreasing sperm quality and decreasing testosterone. An investigation carried out in Denmark in 2015 with 1,250 men aged from 18 to 28 years associate consumption with a decrease in sperm count up to 29%, so 29% less than the non-users. Those who additionally used other drugs, they saw a reduction in the sperm count up to 55%. And then another study carried out by the University of California revealed that cannabis modifies the movement of the sperm within the male genital tract. And what does this mean? Well, when the sperm reach the female reproductive tract, they show very low energy levels to perform their movement, especially at the final stretch, in which having a good contribution is essential to be able to cross the oocyte and fertilize it. Another drug that is one of the most widely consumed substances is alcohol. And there's an increasing number of studies linking alcohol consumption to reduce fertility in both in men and in women. But today we are only going to focus on the men. So alcohol consumption may alter testosterone secretion and spermatogenesis. In fact, the European Association of Urology confirms that heavy alcohol consumption produces significant spermatozoon morphological changes, a decrease in seminal fluid volume, and lower sperm concentration and sperm motility. It's also have been demonstrated that alcohol increases sperm DNA fragmentation. And this increased sperm DNA fragmentation affects sperm quality and the fertility potential of the spermatozoon. It further demonstrates that alcohol incapacitates the sperm ability to trigger the fertilized oocyte and development for the implantation. So there is an increased risk in certain occupations that require close contact with substances or physical agents toxic to fertility. And these are pesticides, which involves farmers, radiation, heat, that involves workers in furnaces, foundries, or conductors, and glycol ethers that are mostly used in shipyards and foundries. So it's been documented that these physical agents, such as heat or radiation and methods, are toxic to sperm in workers with a high exposure. But further investigations are necessary before definite conclusions are reached on these factors. And that brings us to talk about electromagnetic radiation, because the use of mobile phones, laptops, and wireless internet technologies such as Wi-Fi or 5G modems has increased concern about the effect on the male fertility, as these devices constantly emit electromagnetic radiation. So this radiation could alter male reproductive endocrine mechanism and consequently affect testicular functions. So the exposure of mobile phone electromagnetic radiation decreases sperm viability, motility, and sperm total antioxidant capacity in investigations with animals. So this is why we need to conduct more studies of the biological effects of these radiations emitted by these devices on human reproductive systems, because it's not fully determined. And now I want to comment about paternal age. Paternal age is not really an environmental factor, but I wanted to introduce it in the presentation because, well, it's something that we can decide, and it's something that it's in our hands when we decide when we want to be parents. So that's why I wanted to include it in the presentation. And because the average age of the parenthood has been increased in the recent decades in Western countries, in parallel with the increase in maternal age. But we know the importance of women's age for reproduction, whereas for men it's less known, although there is an increasing scientific evidence. So there is no universal definition for advanced paternal age, but the most widely criterion to define it is more than 45 years at the time of conception. And the physiological aging of the male reproductive apparatus can be manifested in various forms. First of all, the oxidative stress increases, and this can cause cell damage, including DNA damage. Also, decreasing levels of testosterone because of the aging of the male, and this reduces sperm mobility and volume. Also, lower embryonic quality in assisted reproductive techniques, increased risk in psychiatric diseases, such as TDAH or autism, and an increased risk of miscarriage. So until now, I was talking about all the factors that can affect in a negative way the sperm quality, and now I'm going to talk the things that can improve the sperm quality. And the most common factor that is known that can benefit the quality of the sperm is the diet. And because in recent times, various studies have been carried out to determine how diet affects seminal quality. A healthy diet for fertility will be the one that is varied, low in fat, and high nutritional value, rich in water, absent of toxic substances, and that favors the intake of natural products over the processed ones. So a diet rich in nutrients, such as omega-3 fatty acids, antioxidants that eliminates excess of free radicals, such as vitamin E, C, or D, beta-carotene, selenium, zinc, and folate are associated with an improvement in sperm quality. It has been shown that the role of these antioxidants in different vitamins, both in terms of preserving sperm DNA integrity, mobility, morphology, and concentration. So generally speaking, the oxidative process that accompanies aging has a degradation effect on the DNA integrity. So it's logical that the normal consumption of antioxidants preserves it from avoiding the fragmentation. It is always recommended to integrate these nutrients into a healthy and balanced diet, but we know that sometimes it's difficult and with work stress or not having enough time for taking care of the diet. So today we can find some vitamin complex in pharmacies that incorporate all these named elements and can help men to improve their seminal quality in treatments of 3 to 6 months. And another important factor to mention is physical activity, as it keeps oxidative stress at low levels and reduces inflammation. It also prevents obesity, as we said before, and therefore protects against diseases of the endocrine system. The positive effects of an active lifestyle on spermatogenesis have been confirmed by comparing sperm parameters of physically active men and sedentary men. So moderate training is associated with improvements of sperm DNA integrity and sperm quality. But intense physical exercise can have the opposite effect, a decline in the quality of the sperm and an altered hormonal profile. So to conclude, I want you to remember that fertility is not mathematical. This is a combination of factors, and therefore it's important to pay attention to everything that we've mentioned because, well, it's a combination of all these factors or other factors that we can't control. And it also should be borne in mind that each case is unique, and before testing or changing life habits, it's better to be advised by a specialist. So thank you very much for listening, and now I'm ready for your questions.
Excellent. Thank you so much for your presentation on that topic, and of course for all those little things you have explained. It's again quite a lot of information, but I'm sure it has been useful. And now you can ask your questions, so don't hesitate. If you have any, go ahead and type those in, and Elisa, I'm sure, will be happy to answer them for you. And we do have a question from Karen already, so let's have a look at the first question.
Okay.
So, test sperm fragmentation. How fresh the sperm must be? The clinic is in a different country and would take a few days to arrive.
Different country? Okay, you mean if I'm not really understanding the question. You mean if the sperm is freezed or if it's fresh? Okay, if it's fresh, you just use it the day that you have it. So I don't understand. The clinic is in a different country. Well, of course, the sperm, you have to use it in the moment. You can't, if it's fresh, you have to use it in a moment. You can't use it 3 or 5 days later. So you could only do that if you freeze the sperm. I don't know if I have answered this question, but
thank you. So, so in order, okay, just give me a second because I think no, it's another question. Okay, so Karen, if you would like to add anything, of course, go ahead. But in just for the test sperm fragmentation, you would need to fresh can be used, and of course, then it has to be done straight away. Of course, yes, that's what you mean.
Yes.
Okay, thank you, and let's have a look. Okay, and next question is up. Is glutathione good for sperm morphology? Can you recommend something for morphology?
Well, okay. All the amino acids or all the components can be good for morphology or for motility or for the sperm itself. But of course, it will not completely correct the morphology. I mean, this is all a combination of factors, and this is all about life habits. If you take this, but you still smoke or drink alcohol or have obesity, it will not improve morphology. What will improve everything, it's the convenience of all the factors that we mentioned. Okay, so it's not only one thing you need to combine all of the factors that we mentioned for an improvement of the sperm.
Okay, thank you so much for yet another question and your answer to this, of course, Elisa. And let's have a look at the next one. So, what amount of sperm should we preserve before planned radiotherapy?
Okay, this is a good question. Well, it depends how is the sperm before the radiotherapy. If you have a good quality of sperm, I think with 1 or 2 or 3 fresh sperm that we can freeze, it will be okay. If the sperm is already, it has already a bad quality, you should have more freezed sperm samples.
All right, that makes perfect sense, of course. Thank you so much. And actually, there is a follow-up, okay, from Ella.
Yes.
Let's have a look at the follow-up then. So do you know if radiation done to other part of body, not pelvic, would affect fertility?
Well, it depends where, and of course we recommend better to freeze, even if there's no, even if it's not in the area of the testicle. I think it's better to freeze just in case. So maybe it will not affect, but if it affects, it's not it's irreversible. So it's better to freeze just in case that you don't have later problems.
All right. Again, thank you so much for the explanation to this one. More questions are coming in. And actually, we will go back to the question from Karen, the question about DNA fragmentation. Okay. So, yes, the clinic advertises you can send fresh sperm sample overseas and they can test fragmentation. So if I understand, it's not possible to test for fragmentation on same day as sample produced.
Okay, maybe some clinics do that. We don't do that. We say always that the sperm has to be, if you want to do a test to the sperm, you need to do that 1 hour after the sample has been taken, because this is the best way to know how the sperm is. If it passed more than 1 hour of the fresh sperm, you can have less mobility, less vitality of the sperm, and even more fragmentation. So we prefer to do the fragmentation when it's fresh in 1 hour until the 1 hour when the sample has been taken.
All right. Thank you. Okay, and for the follow-up, thank you so much, Karen, and of course, thank you, Elisa, for answering that. And of course, there's a thank you from Karen for you. Okay. Okay, Lisa has another question for you. So, could sperm DNA undergo impairment through in vitro handling after the collection?
Impairment through. I don't really understand. I have to say I'm sorry because my English is not so good.
So I believe, if it can get damaged, I guess, yeah.
Okay,
or
after in vitro handling,
DNA.
No, of course not. We use it, as I said, in fresh. Even if you freeze the sperm, it doesn't create more DNA fragmentation. So it doesn't has to go bad. So no, I would say that's this.
All right. Thank you for your question and, of course, for your explanation. That's very important to know, of course. Okay, next question we have here. Does chemotherapy always affect fertility? Mild one also would affect, or it would require more time to again produce healthy sample?
Well, it does affect fertility. It has been demonstrated. Of course, depending on the dose and depending on the radiation that you have, it can be worse or better. So the best thing, if you are in the middle of chemotherapy, it's to confirm that the sperm is still good. If you still have some sperm and some mobility, it's better to freeze it again. I know I have said it a lot of times, but I think it's the best thing you can do. And maybe it doesn't affect, maybe later it goes better with time, but it's better to have this secure.
All right, so it's better to simply cryopreserve this as well. Yeah. Yes. Of course, that makes perfect sense. Thank you so much indeed. And let's have a look. At least for now, we do not have another question. Okay. But I want to make sure that you have asked all the questions, of course. So if you haven't already asked it, go ahead and do it. But if not, of course, remember that I'm sure Elisa and her team at Vistahermosa, they will be more than happy to help you out. And as I always say, you can simply get in touch with them directly if you would like to find out some more details. And also you can use this link, and with this link there's an option for you to get in touch with the team, and I'm sure they will simply get back to you. If not, if you don't have any more questions, of course we will be finishing for tonight. So thank you so much, Elisa, for joining us for sure once again, for your for spending this.
Really answer very good some questions, because sometimes my English is a little bit bad.
It's all good, of course, don't worry. I mean, I think everything should be quite clear, and okay. If you and of course, as I've mentioned, if you would like to add anything, then just go ahead and type this in. But as you can see, we have another thank you, so I guess everything is clear, so don't worry. Okay. As you can see, Karen has wanted to thank you as well. Very useful, that's for sure. And before we finish, Elisa, anything else you would like to add?
Well, only that I hope that you're all okay, that you finally can become pregnant, which, I mean, if you're here, it's because you are trying to. So anything that you need or anything that you want to make clear, you can always call our clinic, because we will always going to be there for you. So, and I hope that everything goes better, and take care with COVID times and everything.
Of course, thank you so much indeed for that. And well, we will be finishing for tonight. So thank you for joining. Thank you everyone for spending this Friday evening with us as well. Yes. I mean, it's a Friday after all. And I'm very happy also to see you here and asking all those questions, because that means what we are doing makes sense. And there are more other questions coming up, of course. So it's like every single day we have different topics, and you are here. So we are very, very excited that it's let's say it's working, and we can help you out, even if a bit, as I always say. So thank you so much, everyone. Thank you, Elisa. I can also add that, of course, we will be back on Monday. So if you haven't registered yet, go ahead and do it. We will be back with another topic on male fertility. So I hope you will be able to join us at 8 p.m. 7 p.m. UK time on Monday. And well, as you know, this has been recorded, so if you missed any parts, you will be able to simply watch this on our YouTube channel. It will be available tomorrow. And as you know, there are over 300 IVF webinars on My IVF Answers. So if there are other topics you would like to check, this is the page to do so, website to do so for sure. And well, have a lovely weekend, everyone. Elisa, once again,
thanks
a lot. Take care, everyone, and bye.